Well, I am Anand. Today my lecture is antihistamine. Before going to this topic, we should know what is histamine. Histamine is nothing but it is an organic nitrogenous compound. It is also a neurotransmitter. It is mainly produced during immune response by mast cell and basophil. It is mediated by H1 receptors. What is H1 receptors? These are the histamine receptors, specially present in nerve endings, smooth muscles, and glandular cells. Now, let us see what is antihistamine. They antagonist to histamine. What is antagonist? Which is a substance or drug that acts against and block an action. This antagonist to histamine is mainly effect on H1 receptors and suppress the histamine action. Why need this suppression? Sometimes our immune response will be in extreme level, mainly through this allergen. Whenever the allergen or antigens coming into our body, it will lead to some extreme level, mainly through this allergen. It causes discomfort. It may harm, especially to the respiratory system. Now we can move to classification. This antihistamine is mainly classified into two. First one is first generation antihistamine and second one is second generation antihistamine. Now we can move to first generation. This drug having the greater anticholinergic effect is mainly acting on parasympathetic nervous system and it is suppressing the neurotransmitters acetylcholine and it will lead to increased sedation and drowsiness. Whenever we take this type of medication, of course, we will get some sort of sedation and drowsiness. Second generation antihistamine. This drugs having less anticholinergic effect. So, this drug having less sedation and drowsiness. These are the first generation antihistamines. These are the second generation antihistamines. Okay, first generation antihistamines. Examples are astatidine, brompheniramine, chlorpheniramine, cetirizine, diphenhydramine, hydroxyzine, and meclizine. Second generation antihistamines examples are fexofenadine, loratadine, and acetaminophen. Next, now we can move to mechanism of action. Is mainly block the H1 receptors and it is combating the histamine and it is decreasing the cellular response. This drugs having antipruritic properties. What is antipruritic? Is a substance which is used to relieve itching. This antihistamine side effects are sedation, some anticholinergic effects like a dry mouth and dry eyes, mydriasis, dizziness, tinnitus, urinary retention, and tachycardia. The most of this with first generation, this side effect is mainly we can see in first generation antihistamine, and also we can expect headache. Now we can move to pharmacodynamics. How it is affect on our body. In CNS, it leads to drowsiness, sedation, fatigue, and dizziness, and disturbed coordination. Some other anticholinergic side effects are drying of respiratory mucous membrane, GA upset, nausea, dysuria, urinary retention. What are the nursing implications of antihistamine? First, empty stomach or 2 hours after meal. This drug has to be given in empty stomach or after 2 hours after meal. Give with food if GI upset occurs. Suppose the patient having some sort of GI upset, then we have to give this drug along with food. Offer sugarless lozenges, hard candy, and give frequent oral care because there is a possible chance of getting mouth infections. So, the oral care is must. Provide safety measures, side rails up, assist in ambulation, advise to not to drive or operative dangerous machineries, because I already told you these drugs having the side effect of drowsiness and dizziness. And provide adequate hydration. That means we have to give plenty of water. Allow the patient to void before administering the drug. Caution the patient against the use of OTC drug. That means over the counter. Without prescription, we are purchasing the medicine. That is the thing. Then alcoholic beverages and sedatives because they cause extreme sedation. If you take this drug along with alcoholic beverages, it will lead to extreme sedation. Next, evaluation. We should monitor the patient response to the drug, whether the patient having any drowsiness, any other side effect. All those things has to be evaluated properly. The adverse effect, the effectiveness of comfort measures employed, all those things has to be employed, has to be checked properly. Thank you.